is a game-changing new cardiac procedure that allows the aortic valve to be replaced without cutting the chest, without big scars, and without open heart surgery. The procedure is done using a wire that is threaded through the groin and placed in the left ventricle. A balloon catheter then expands the old valve, allowing the new valve to be put in its place. The valve is generally made of animal tissue, usually from a cow or a pig. The downtime of the procedure is significantly shorter than open surgery in terms of recovery, usually about 3 days in hospital. Some patients are surprised that they will be up and walking around ready for home some 3 or 4 days later. The main condition we use Tavi for is aortic valve stenosis, one of the most common and most serious heart valve disease problems. This condition causes a narrowing of the aortic valve opening and restricts blood flow from the heart. Symptoms usually include breathlessness, chest pain, pressure or tightness in the chest, fainting, feeling lightheaded, palpitations or a noticeable heartbeat, and a heart murmur. There may also be a noticeable difference in your ability to do activities that require mild exertion, like mowing the lawn or walking upstairs. Sometimes there are no symptoms even when people have severe stenosis, and sometimes it's a partner that may alert a patient to an increase in fatigue that patients may not always notice themselves. The bottom line is, when in doubt, get it checked out. Currently we use Tavi only on patients who are considered high risk to undergo normal open heart valve surgery. Many of these patients are generally older, have severe lung disease, kidney disease or other comorbidities. In the past, these patients would have been considered inoperable or at high risk of complications or death from open heart surgery. Tavi is a classic example of continually evolving heart technology. Originally, it was only used for patients considered truly inoperable. Then, as the procedure became more used, indications were expanded and included high-risk surgical patients. Currently, for low or medium-risk patients, open heart surgery is preferred, as this is the gold standard for valve replacement, and has been tried and tested over several decades with generally excellent results. We know Tavi valves may last up to 5 years, but because the procedure is relatively new, we don't know if these valves will be as durable as conventionally placed tissue surgical valves, which have been shown to last up to 15 to 20 years depending on the individual. I look forward to seeing you for your Tavi procedure.